Hello, thank you for coming to my pre-recorded talk. It has touched us all considering the social impact of touch in the COVID-19 pandemic. My name is Isobel Sigley, and Rochelle Ackley kindly asked me to contribute to this Social Bridges event to add a new perspective to the discussions. I am a doctoral researcher working on my PhD in the UK at Loughborough University in the Midlands, and I am based in the English Literature Department. My research investigates touch and the haptic in short fiction by late 19th and early 20th century women writers. Because I research touch, when the COVID-19 pandemic first took hold in Europe, I was sidetracked in a way from my focus on literature, and I couldn't help using the analytical skills that I'm trained in to try to process the emerging discourses on the tactile sense amid the coronavirus. Likewise, because my PhD follows a political feminist approach when looking at literature in the build-up to the suffragette movement, the political implications of touch during the pandemic were startlingly apparent to me. This presentation is hence born out of this thinking, but is perhaps as a result UK-centric and anecdotal or philosophical and discursive, rather than data-driven science, as it were. In my discussion, then, I am going to consider how the policies that emerged, particularly towards the beginning of the pandemic, that sought to restrict touch, social distancing, self-isolating, shielding and working from home, consolidated social privilege for certain demographics who were more easily able to follow the guidelines, as well as perhaps more blasé about doing so. To begin, I'm going to offer a couple of examples of popular celebrities whose actions in response to the pandemic over a year ago indicate the disparity between how the pandemic affected those with privilege differently to those with less privilege. Perhaps you'll remember the storm on social media that erupted after Wonder Woman actor Gal Gadot posted a video in which she and many other A-list celebrity stars sang a montage of John Lennon's song, Imagine. This perhaps well-intentioned attempt to boost morale was quickly attacked for being tone deaf, as it in many ways highlighted the inequalities within Western society. Celebrities relaxed in their big houses, many of whom likely had no real need to venture out into the shops, and who could be assured that their wealth would secure them the top-rate medical attention if they needed it. From such a comfortable position, they tried to boost the morale of thousands who occupied much more vulnerable positions, with many losing jobs and homes or working on the front lines in hospitals, schools and shops, where they were put at an increased risk of contracting the virus. The efforts of these celebrities were trivial and out of touch with the severity of the situation, leading us to question whether we really are all in this together, as Gadot asserts in her Instagram caption. Nowhere was this disparity more apparent, though, than in a video that pop star singer Madonna posted on her social media at around a similar time, in which, relaxed in a rose petal-filled bathtub, she offered her thoughts on the pandemic while a piano played softly in the background. Madonna claims in the video that that's the thing about COVID-19. It doesn't care about how rich you are, how famous you are, how funny you are, how smart you are, where you live, how old you are, what amazing stories you can tell. It is the great equalizer. Madonna's very staged video, in which her totally unrelatable luxury takes centre stage, makes a joke of her invocation of equality, which could easily be construed as offensive to those whose lives were totally upended with little to no security because of the virus. Indeed, this idea that the COVID pandemic is a collective, universal, homogeneous experience is an idea that, through a focus on touch, I will problematise in this presentation. Before delving into the depth of my analysis, however, I want to outline my understanding of touch, the understanding which informs both my PhD and my analysis of COVID-19. My approach considers how touch functions in social, historical, and philosophical terms rather than its mechanical functions. And the three scholars who I will turn to today to define the aspects of touch that I believe are significant are cultural historian Constance Classen, geographer Mark Patterson, whose home and human geography belies his interdisciplinarity, and philosophy professor Matthew Ratcliffe. Classen's work over the past 3 decades has established a long history of the senses, chronicling the varied and changing cultural significance of tactility along the way. The first point, as you can see, refers to Classen's understanding of the gendering of the senses through time. She writes, quote, "While the senses were typically feminine in nature when opposed to male rationality, when considered on their own, they could be assigned feminine or masculine connotations. Touch, taste, and smell were generally held to be lower senses, and thus were readily linked to the lower sex, women. Similar associations were made between touch, taste, and smell and the lower classes, the lower non-European races, and the lower species. Without endorsing these sensory hierarchies, the fact that these associations have existed historically sets a precedent for analyses such as mine, in which the senses come to reflect social values, as I argue that the sense of touch reflects social values in times of COVID-19. Classen describes the consequences of gendering the senses as multifold. She observes, quote, "The fact that the male senses of sight and hearing were classified as distance senses, and the female senses of smell, taste, and touch were characterised as proximity senses, was interpreted to mean that men were suited for distance activities, such as travelling and governing, while women were made to stay at home. As we all know very well by now, in times of COVID, words such as distance and proximity have added resonance. And the fact that the distance senses were classified as masculine while touch was coded as feminine has had specific consequences over the last 18 months, which I will discuss further in due course. Another quality of touch that Classen discusses is its close relation to the other senses and to the emotions. She remarks, quote, "All of the senses can be and have been thought of as having tactile dimensions. Even sight involves eye movement." Of the communicative capacity and immediacy of touch, Classen writes, quote, "Our hands and bodies learn to speak a certain language of touch, a language shaped by culture and inflected by individuals. We learn what to touch, how to touch, and what significance to give different kinds of touch. Laden with meaning and bound by rules, touch has what could be called a vocabulary and a grammar. When one thinks of the immediacy of touch, however, language seems too formal and linear a model for tactile communication. Caresses and blows express profoundly and instantly what language labours over at length. A kiss is worth 1,000 words. Touch precedes, informs, and overwhelms language." Classen could not have predicted the coronavirus pandemic, but she has captured accurately the effect it has had on touch, bound by rules. While we have had to learn and unlearn what and how to touch, the stringent grammar of touch has been brought further into view. Meanwhile, the ability to spontaneously communicate affect through the immediacy of touch, through the kiss or the blow or the caress, has been curbed, leaving us to labour over and grapple with expression, something that has been taxing in innumerable ways. How to wish a mother happy Mother's Day without a kiss, how to show appreciation to nurses without a heartfelt hug, how to congratulate a child without a thundering high five, how to express ourselves without touch when we have a face covering that limits us, or to appropriate Classen that overwhelms language by muffling our words, has been one of the great but inarticulable struggles engendered by the pandemic. Mark Patterson's work builds upon that of Classen. He reiterates the idea that touch is pervasive, since it is, in his words, present within every single interaction with objects and a considerable amount of interaction with people. Within waking consciousness, and sometimes within dreaming, it is undeniably present. Patterson also considers the hierarchical status of touch, referring to Aristotle's hierarchy, in which, quote, sight is the superior sense, while touch is relegated to the lowest, basest position. Crucially, as the basest position, Patterson also asserts touch's fundamentality as, quote, the first sense prior to the differentiation into other sensory modalities. Through Patterson, we also get a sense of touch as trustworthy. According to his research, quote, touch seems more intimate, reassuring, and proximal in opposition to predominant, distanced, and even deceitful vision. Patterson observes that, as in the biblical tale Doubting Thomas, in which an apostle refuses to believe in Jesus' resurrection until he can feel the wounds from the cross, quote, touch is associated with verification, the connotations of tangibility being solid, foundational, undeceiving. Ultimately, then, it is the sheer capacity of touch that both defines it and renders it impossible to truly pinpoint, as Patterson's lists make clear. Quote, it is a sense of communication. It is receptive, expressive, can communicate empathy. Touch, Patterson postulates, quote, articulates a rich world, a world of movement and exploration, of non-verbal social communication. It is a carnal world with its pleasures of feeling and being felt, tasting and touching the textures of flesh and of food. And equally, it is a profound world of philosophical verification, of the communication of presence and empathy with others, of the co-implication of body, flesh, and world. For Patterson, the multifaceted sense of touch boils down to the idea of being present in the world and the ability to participate or implicate the world. Fundamentally, it is about connection. This, therefore, accounts broadly for the feelings of isolation and disconnection that have made the pandemic a challenging time, as it has cut us off from the flesh of the world and left us somewhat stranded, starved, lacking the solid, foundational, undeceiving connotations of tangibility. Matthew Ratcliffe reiterates this point about connection. Ratcliffe's work troubles the perceived boundaries of touch, which are, according to him, not always located at the point in which the body meets the outside world. He uses the example of typing to demonstrate a diffusion of boundaries that constitute what he calls situatedness. When typing flows, the point in which the fingertips hit the keyboard is not perceived as a boundary. What characterises rootedness in a familiar situation, belonging to a context, Ratcliffe writes, is the extension and diffusion of boundaries, a blurring of the self-world distinction. Perception of the body as a discrete object with clear boundaries is, at the same time, a failure to perceive and engage with the world, a loss of connectedness. When the body and the world interact seamlessly, one can be said to be rooted or situated in a familiar context. However, when the distinction between the body and the world is apparent, we sense a disjunction with our environment. This latter feeling has been ubiquitous throughout the pandemic, in which our bodies have been perceived, perhaps more than ever, as an object whose interactions with the world needs to be policed through hand-washing, sanitizer, and masks. We have become more aware of the boundary at our fingertips, through which the threat of the coronavirus materialises, and in turn our sense of being situated in the world, connected or rooted, has been repeatedly tested. This increased consciousness of the body's objectivity in the face of a threatening virus is, as I intend to demonstrate, more keenly felt by some than others. I will now proceed to discuss in greater detail, although not exhaustively, the intersections between COVID-19, touch, and issues of class, gender, ableism, and race. If COVID-19 has vilified touch, it has vilified the touch of Asian bodies most emphatically, as the virus sparked an amplification of anti-Asian racism. By no means a new form of discrimination, when then President of the US, Donald Trump, decided to label the virus the Chinese virus. He gave license to more explicit hate. Proximity with Asian bodies was met with increased suspicion in the early months of 2020. A report from the 1st of February in the Guardian newspaper in the UK described how Asian residents in Southampton, in southern England, were asked to leave a public bus for wearing face coverings. The fact that these protective measures have since been made mandatory on public transport in many parts of the world indicates how Asian bodies were among the first to be perceived as an object whose reinstated, emphasised boundary with the world derooted them from their environment. This has even led to increased instances of physical violence, with incidents in the UK, including a takeaway owner was spat on and an East Asian student in London suffering facial injuries after an attack on the famous Oxford Street. These racist attackers subjected minorities to the violent touch of white bodies, as blows of coercive physical abuse demarcated Asian bodies as unsafe and blameworthy, while seeking to protect and maintain white bodies as clean or as victimised. The use of touch here nevertheless exposes the irony or hypocrisy of such racist violence, as it instigates proximity and contact with the very object, the Asian body, that these attacks allegedly deem infectious. Touch is reciprocal, what you touch also touches you. It becomes apparent, therefore, that whatever appears to motivate these attacks, retribution for the virus in this instance, is merely a thinly veiled excuse beneath which lies deep-rooted racism seeking an outlet. The disproportionate representation of Black, Asian, and minority ethnic fatalities from the virus further indicates their systemic vulnerability. While Asian bodies were vilified, key workers were applauded and safeguarded wherever possible. But the valorisation of key workers emerges as problematic when approached through a class perspective. Though not all key workers are necessarily considered working or lower class, the majority of these roles are not traditionally signs of privilege. Conversely, roles that were not deemed essential and were therefore adaptable to the policies of social distancing, isolation, and working from home emerged as a new marker of privilege. Indeed, the ability to social distance or self-isolate within your own household was not as easily managed for large and non-nuclear families, key frontline workers, and poorer communities. These policies also endangered those whose home environments engendered more danger or health risks, such as through the rates of domestic abuse which increased during national lockdowns. Densely populated, aged, and impoverished areas also struggled more than the more affluent areas because social distancing was less feasible. There was less space, homes are occupied by more residents, communal areas are shared by more people rather than in private gardens, and older residents require more help from their community. Poorer healthcare systems also became more easily overwhelmed, especially in countries in which healthcare is poorly funded or in which insurance is financially dependent. The ability to deny touch and to social distance is hence indicative of a class-based hierarchy. The key occupations that are predominantly occupied by working-class citizens are on the front line, and it is their touch that is vital and life-saving. Yet, these essential workers are not highly paid, and they're not well esteemed in society. Meanwhile, many office-based jobs were able to adapt to working from home, with staff safeguarded and able to continue to work, both of which were privileged positions compared to dangerous frontline roles or furlough pay deductions or even redundancies. This emerging class marker is apparent again as many of the positions classified as low-skilled in the UK when the government drafted their immigration points-based policy for post-Brexit are the very positions that are essential. So the sudden commemoration of these roles highlights the paucity of respect and the substandard compensation awarded for this type of demanding, necessary work. The wealthier, more well-off classes then tended to adapt better to restrictions on touch, through their professions and working from home, and/or through their greater standard of home life, meaning things like more flexibility to source food when stockpiling created widespread shortages, more room to coexist within households, more stable internet connections to facilitate work meetings and online classes for school children simultaneously. The myriad of small tokens that are often taken for granted continue to make life easier for those that have them, while impoverishing those without. This is not to say that the wealthier or upper classes didn't suffer. Coronavirus disrupted almost every facet of life, but rather that the division of class throughout society put some at greater risk than others, not just of contracting or spreading the virus, but of other health and safety risks too, while the privileged were, in a general sense, more equipped, at least materially, to face the pandemic's challenges. As well as class, the division of essential labour also took on a gendered quality, with healthcare workers being made up of predominantly female workers, as well as other essential professions, such as teachers. Of the essential jobs, the two which most emphatically implicate women are also the two that likely incur the most tactile interaction with nursing or care administration and classroom contact. As we saw briefly via Classen's work, touch is in an inherently gendered sense. It's coded female. It is consequently tied to stereotypically feminine characteristics, such as sensitivity, emotionality, and care, which find natural expression in tactile acts, as well as featuring heavily in typically feminine professions. The pandemic has also made it a struggle to find alternative ways to accommodate these feminine characteristics since restricting touch, and this has led to halfway solutions in gestures, such as the elbow touch or air hugs and kisses, in place of affectionate contact. We've also relied more heavily on digital expressions, with GIFs or GIFs, depending on how you pronounce it, and emojis playing a big part in communication. In restricting feminine expression, the pandemic has also incentivized the gendered binary, privileging masculinity over femininity and rationality over emotionality. This had fatal consequences as it translated into the political decision-making at the beginning of the pandemic, which privileged rational scientific theories of herd immunity over the lives of the vulnerable and elderly. Indeed, as governments failed to act swiftly to prevent the virus spreading, preferring instead to attempt to control its peak, leading Boris Johnson to blatantly say that, quote, many more families are going to lose loved ones, the shortfalls of purely rational thinking are evident, while the importance of sensitivity becomes undeniable. An article in The Conversation by two scholars from Concordia University, and apologies for the botched pronunciation, Louise Champeau-Paillet and Anne-Marie Croteau, discusses this very topic in relation to female-led governments and their greatest success in battling the virus. They credit countries including New Zealand and Denmark as, quote, supporting evidence that women are managing the crisis better than their male counterparts, since the approaches of female-led governments prioritise, quote, resilience, pragmatism, benevolence, trust in collective common sense, mutual aid and humility, instead of an outdated mode of leadership based on command and control, which male-led governments more accurately represent. Despite being coded feminine, female interaction was of less a concern compared to the male-dominated formal handshake, which made headlines around the globe, with the Great Reporter re-evaluating the history of the ancient gesture, and German news outlets discussing the ban on handshakes in football matches, just two of many examples. This greater interest in male-coded interaction mirrors the societal privileging of the male and a greater bias towards protecting men, potentially born out of the early statistical analysis that suggested the coronavirus was more fatal for men than women. Resilience to lockdowns have also challenged people differently according to gender, and statistics provided by King's College London elucidate this. They report that 54% of women who are finding the latter lockdowns harder blame difficulty in meeting up with others as a key reason, compared to just 33% of men who give the same reason. Men, on the other hand, are more likely to say that boredom is a key reason for their struggle. This suggests that women are missing contact, physical or otherwise, much more than men. King's College London's study also reports that 7 in 10 people have felt let down by the amount of rule breaking they've witnessed, while conversely 1 in 8 have felt embarrassed by people they know sticking too closely to the rules. The fatal consequences of governmental hesitancy in the face of the virus magnified the impacts of the pandemic on the elderly and those with underlying health conditions, for whom touch has been virtually impossible outside of the safety of their homes, and social distancing and such rules have been absolutely imperative. Through this, and through attitudes towards the protective rules, an emphatic ableism emerged, in which the lives of many vulnerable people were devalued and neglected. This contentious phrase, "would have died anyway," belies a prejudice which views the lives of vulnerable people as dispensable. The privilege of able-bodied people has been abundantly clear in the inconsiderate flouting of the rules and the reluctance to submit daily routines to life-saving restrictions on touch. The protests in America, in which hundreds gathered in close proximity to end the lockdown and to prioritise the economy and the right to work, alongside the rejection of face coverings, is a clear invocation of able-bodied privilege and a blatant jeopardising of vulnerable lives for self-interest. These protesters commandeered the feminist rhetoric around abortion rights by hijacking the hashtag #MyBodyMyChoice, showing again a hypocritical disregard for the vulnerable bodies of others by overriding the concern of unwanted or threatening pregnancies for their own self-interest. In conclusion, then, the sense of touch has historically been laden with social and cultural meaning, and as the pandemic tore through our social and cultural fabric and forced us to renegotiate our daily routines, touch took a hit. But the extent to which we rely on touch for our emotional and physical well-being also materialised more strongly than ever. It is therefore fitting that a tactile sensation of a pinprick in the arm as the vaccine pierces the skin and protects the masses from severe illness at the hands of COVID-19 hopefully brings about much longed-for stability. Nevertheless, as we enjoy our first contact with friends and families, it is important to recognise that COVID-19 is not yet eradicated, and that there are still countries suffering and far behind in vaccination programmes. This evidences, yet again, the disparity between the privileged nations and the underprivileged in responses to and recovery from the pandemic. Thank you very much for listening.
And thank you. I'm afraid you really are cut off at the end there, Isobel, but I don't think that's a problem on my, I think the video was somehow saved a bit short. We are already at past, but we have got a ton of questions coming through. I'm going to just quickly give you Uta Sailors, which I think was the first one after my rambling. Uta says, it sounds as if the reduction of touch is negative only. However, not needing to hug or shake hands can be positive as well for some people. And she asks, how do you think this fits together?
I guess having sort of listened to some of the papers earlier today as well, the benefits of people not having to touch strangers as much, that don't want to touch strangers as much, that can help in those regards. We've got alternatives for people that are uncomfortable with that kind of social touch, which is a positive. And also we've developed a lot of other channels to cope with the pandemic that have increased accessibility. So there's lots of benefits that have come out of this time of need.